Hello friend, welcome to the channel Pharmacy Dictionary. In last video, I have tried to explain you regarding the advantage and few limitation of oral route of drug administration. But in this PowerPoint and animated video, I will show you the exact reason for the limitation of that particular oral route. So in this video, we will see what happen if someone take tablet, what is the actual process of their disintegration, dissolution, and finally to their systemic effect for which we have taken that particular drug. So let's start today's presentation with the help of animation. Let me assume the condition of our stomach with a beaker. This is beaker actually, but assume this as a stomach and this is water filled in the beaker, and please assume this as a water or any other fluid present inside the stomach. So we can say this is the environment of stomach. I am going to duplicate it. That means I am going to compare two types of tablet, that is two types of oral doses form actually. So this is another beaker having another level of water, or we can say this is the environment of the stomach. Now I am going to show you with a traditional tablet. That means a tablet which is basically used for treatment of pyrogen, that is antipyretic drug, or reduce the fever, or any other analgesic drug. So any kind of tablet it may be. So this is a traditional tablet, uncoated tablet. So this tablet is taken by any person or any patient. Then after taking via oral route of drug administration, this tablet goes through the stomach. And in stomach, it may interact with the fluid present inside that. So it will go for the disintegration and dissolution process. What is disintegration? Conversion of big molecule or big form into small particle, or breaking the tablet into small particle is simply known as a disintegration. So please pay attention on this diagram and please observe the process of disintegration. As you can see, they are going to be disintegrate. So after disintegration, that particular tablet is completely dissolved. Now you will not find any traces of that particular tablet, and we can assume this as a stomach. So after some time, that tablet will produce its action, and you can assure this, or we can confirm this with the color of the liquid. So after some time, what will happen? After dissolution, that drug will move for the small intestine, and you know it very well. From small intestine, that will reach to the blood circulation, and after reaching to the blood circulation, that will move through all over the part of our body, and will start producing a systemic effect, or effect for which it was taken. So what will happen now? This drug along with the water will move through the small intestine, and from small intestine that will reach to the blood vessel. Now see, this is the drug. Now it is moving along with the blood throughout the body. So once it will reach to the site of action, that means desirable part at which you wanted its action, so that will start producing its systemic effect. So to produce the systemic effect, that traditional tablet which we have taken by oral route of drug administration will go through several processes. The first process was disintegration. The second process was dissolution. Then after third process was movement of drug from the barrier or different types of cell across the membrane. So it will reach finally to the blood. After reaching to the blood, it will reach to the site at which it has to produce its action. So in this step, that will produce their systemic effect. This was for the traditional tablet. Now let's assume the same process with an effervescent tablet which we have to dissolve before taking via oral route of drug administration. That could be a powder, that could be a granule, or nowadays that could be a tablet too. So first of all, we have to dissolve that tablet, and after dissolution, that solution has to be taken. So let's assume this is an effervescent tablet of different kinds. It is meant for the treatment of ulcer problem or to neutralize the acidity. So this effervescent tablet will goes through the water, because we are going to take this water as a solution after the disintegration dissolution of the particular drug. But remember, this is not a traditional tablet. It will easily and rapidly produce effervescence and dissolve very fastly as compared to the traditional one. So what will happen? The tablet will disappear and start evolving the gas, that is called effervescence. Now this is ready to use, so it will produce action. In this case, if you want to compare with the first one, that is traditional tablet, so it will take lesser amount of time as compared to traditional tablet. So it will produce systemic effect a little bit faster as compared to traditional tablet which we have taken earlier. So in this video, we tried to compare two types of oral route of drug administration, or we can say two doses form under the oral route of drug administration. First one was tablet, and the second one was effervescent granule or effervescent tablet. In this two tablet, the main thing is that the dissolution time, dissolution rate actually. So whenever we take a drug via oral route of drug administration, it will take time to produce a desirable action. That is the main limitation of that route. So friend, that's all for the day. Thank you very much for watching this video. Hope you will get the point easily. Thank you. Please do take care of yourself.